What I like to do is I like to approach people while I'm working my shift in the pharmacy. And when I notice that they are diabetics, I will ask them some probing questions like, do you check your own blood sugar? Is there anything special you do to control your diabetes? And that starts the conversation and allows me to offer them a diabetes meds check. And when I can book them for a diabetes meds check, I can get further into all the complications that they may or may not know about further testing if they need it, and also about how they can better manage their diabetes through food and nutrition and exercise. It all started with a few of the doctors in my area asking me if I would provide some additional education to patients with diabetes. And the doctors did not necessarily have time to review diet and that sort of thing. So they asked me to get involved a little bit. As I started sort of coaching these patients, I noticed that there were other things that I could do to help them that they either had forgotten about or they had never been told about how to manage their diabetes properly. So I realized that I needed a little bit more knowledge, and that's when I decided to become a certified diabetes educator. This gave me the confidence and the knowledge base to help my patients a little bit better. There are some challenges when working with people with diabetes. Sometimes they will tell you that they don't have the financial means to take your recommendations. For example, if you ask them to eat more vegetables and less carbohydrates, a comment I get quite often is, the vegetables cost more money and pasta is very cheap. That's a struggle that a lot of patients face, and to help them improve is challenging when you're faced with things like that. I think time is another factor. Getting patients to come in and spend the time with you. Either they're busy or sometimes we don't have enough time to spend with them when they come in the store. So booking an appointment and doing a diabetes meds check definitely helps, but sometimes time is still short when we're doing that. And I think a lack of information can sometimes be a challenge. So it would be great if we had everyone's A1Cs and their sugar levels, and if we knew exactly what they were eating, everything could be a lot easier. So sometimes patients don't bring the information that we need, and sometimes healthcare providers are not sharing all the information they could with us. So those are some of the challenges, but we're definitely getting better at working with all of those challenges. Getting a comfort level where you are able to make recommendations, and not only to patients but to physicians as well. I think you want to have a good knowledge base for the condition of diabetes and also for the medications. You need to verse yourself very well on doing insulin dose adjustments, starting patients on insulin, and keeping up with some of the recommendations that Diabetes Canada comes out with every now and then. Once you are comfortable with all of that information, you feel confident about making recommendations. You'll make more recommendations and better quality recommendations to patients and doctors. And for sure, getting your certified diabetes educator status is vitally important. I like to use Diabetes Canada as a good resource, not just for patients, but for healthcare professionals as well. Other tools that I would use would be a lot of online learning modules, and there's a lot out there right now. Insulin manufacturers have really good training programs, which are often given by endocrinologists and physicians. And so there's lots of great learning tools. Also, OPA has some great learning tools, especially when you're preparing for the CDE exam. So I think there's no shortage of tools available to pharmacists. There's lots out there. If you Googled it, you'd come across tons of them, but those are just a few of the good ones.